Hello, everyone. Welcome again into this meaningful discussion in foundations of education. For today's topic is about the psychological foundations of teaching, the learning theories and implications to health sciences education. There are three theories in this topic. One is that the behaviorism, cognitivism, and deconstructivism. Let's talk first about the theory of behaviorism. Before I tackle the theory, let's take a look at what is really a behavior. A behavior is the way of conducting oneself, manner of acting or controlling oneself towards other people, and the range of actions, responses, and mannerisms. Now, these are the reactions we do or react from a certain stimulus. A behavior is a complex area. That's why a lot of theorists and psychologists studied about it, and we can call them behaviorists, and came up with the theory of behaviorism. Now, what is behaviorism? Behaviorism is a theory of learning based on the idea that all behaviors are acquired through conditioning, and conditioning occurs through the interaction with the environment. This is also known as behavioral learning theory in theoretical perspective in psychology that is emphasizing the role of learning and observable behaviors. Now, this theory talks about the factors affecting the behavior of humans and animals. Among all those theorists who studied behaviorism, there are four theorists who are popular by the said theory. One is John B. Watson, Buris Frederick Skinner, Ivan Pavlov, and Clark Hall. Now let's start with John B. Watson. John B. Watson, or John Produce Watson, was born on January 9, 1978 in South California and passed away in 1958. He is often referred to as the father of behaviorism because he formally established behaviorism with his publication classic paper, Psychology as the Behaviorist Views It in 1913. He emphasizes the importance of observable behaviors over mental state, which is his theory methodological behaviorism. Now, he believed that observable behavior should be studied scientifically and that mental states and cognitive processes don't add to the understanding of behavior. Now, this is where psychologists should base on their conclusions about human behavior on objective observations of outward behavior and environment. Now, this study would be conducted in scientific manner and in close observation. One example is that is popular experiment by Watson is Little Albert. Now, Watson, together with his assistant Rosalie, presented the white rat to Little Albert, and the rat, which is neutral stimulus, does not trigger any response. Now, stimulus for your refreshment is stimulus is anything that causes response. Just imagine the relationship of cause and effect. Now, that's why Albert had no response. He maybe don't have any idea what a rat is. But when Rosalie hammered a certain steel that produces suddenly a loud noise, which it is unconditioned stimulus. Unconditioned because it is not yet associated with something. Now, little Albert responded, which is unconditioned response, and he responded with fear. He was shocked and cried. When they paired the sudden loud noise to the white what, this which is unconditioned stimulus and the neutral stimulus, little Albert responded again with fear, which is unconditioned response. It is still unconditioned because of there's still the association of the two stimuli. Now, this pairing was repeated multiple times, associating the rat with the fear response. According to the study over time, little Albert began to display fear and distress, not only in response to the loud noise, but also when presented the white rat alone. Now, this is demonstrated that a conditioned emotional response had been formed. However, this experiment is notable for its concerns, as it involved inducing fear and distress in a child. Today, ethical guidelines for research involving human participants are much more stringent or strict to ensure the well-being and protection of participants. However, this experiment is considered a significant study in the field of psychology due to its contribution to our understanding of classical conditioning, which is Ivan Pavlov studied more of this classical conditioning. So in conclusion, for the little Albert experiment, it showed that conditioning can occur, and that conditioned emotional response can be formed. It provided evidence for the idea that learned associations between stimuli can influence emotional reactions and behavior. Unlike the theory of B.F. Skinner. Now, B.F. Skinner was born on March 20, 1904 in Pennsylvania and passed away on 1990. He viewed human behavior as responses to environmental stimuli and advocated for the controlled scientific study of responses as the most direct means of understanding behavior. Now, his theory, radical behaviorism, is a behavior can be understood by looking at one's past and present environment and the reinforcements within it. It's radical because it considers even our thoughts and feelings as behavior. By its own definition, radical means thorough, relating to, or affecting the fundamental nature. It can be like in mathematical term. Radical is the root of a number. Here in B.F. Skinner's theory, there is a relationship between the past and the present of an individual that shapes his behavior. So imagine you're trying to train a dog to sit. You give the dog a treat every time it sits. Now, over time, the dog learns that sitting equals getting a treat, so it sits more often. Now, this is an example of behavior being shaped by the environment. Radical behaviorism takes this a step further and says that even our thoughts and feelings are shaped in the same way. Now, another example is that if you feel happy every time you see a certain friend, you'll start to think positively about that friend. Now, remember reinforcement. Reinforcement is the process of encouraging or strengthening or motivation to do something. That is radical behaviorism. Now, there is a similarity with this theory, radical behaviorism, with the operant conditioning, which is also the theory of B.F. Skinner. Now, operant conditioning is a method of learning that occurs through reinforcement and punishment. Now, this type of learning, this is where behavior is influenced by the consequences and it follows, or consequences and follow it. It's like a cause and effect relationship between our actions and what happens next. Now, these reinforcements involves one that is the continuous reinforcement that involves rewarding every single instance of behavior. We can apply this to young kids. I believe that that is we can apply this especially in a daycare center classroom to grade 1. This kind of reinforcement that every time a learner got correct answer or answers, by giving him a reward, he reinforced again to do something in your class or got encouraged in or motivated, and the result is you can create a very good interaction inside the classroom, that with this continuous reinforcement, every learner in the classroom might participate. Remember, consistency is very important in this kind of reinforcement. Second, in operant conditioning, reinforcement involves partially offering a reward after a number of responses. This, I believe, can be applied in grades 2 up. There are certain stages or steps first for a learner to do for him to be able to get a reward. Now, for example, if your rule is that if they have a perfect attendance for the whole month, you give them a reward. Again, consistency is very important. So just like what I've said before, without consistency, you could create a negative punishment. If a learner did something good in class or got a perfect score in a quiz or activity, then you forgot to give him a reward once, twice, until you really forgot to give him a reward or to give him that reward, that learner could stop participating in your class, which is not a positive reinforcement anymore. That would be a negative punishment for the learner. Now, what would be the result? He could be he could be naughty or not listening in your classes, right? So that's what B.F. Skinner wanted to prove, that emotional and feelings, cognitive or the unobservable aspects can become a behavior. That a behavior can be strengthened or weakened depending on the consequences that follows it. Positive reinforcement and negative punishment are just two examples how behavior can be influenced. If that's so, let's proceed to Ivan Pavlov because they have similarity with this theory. Ivan Pavlov from 1849 to 1936, he was a Russian physiologist known for his groundbreaking work on the concept of conditioned reflexes. One of his popular theories is classical conditioning experiments with dog. Now he won a Nobel Prize winning research and the impact it had on the field of behaviorism in psychology. Now, his classical conditioning is a type of learning where a person or animal learns to associate with two different stimuli, or this is the technique frequently used in behavioral in which neutral stimulus is paired with a naturally occurring stimulus. Now, this is all about forming a connection between two things that may not have been connected before. Now, let's take a look at the diagram. The diagram is divided into three different situations: before conditioning, during, and after the conditioning. Now, let's say that this dog is Max, that dog. Before conditioning, the treat is unconditioned stimulus because it naturally leads to a response from Max, which is excitement, or it is not yet associated with something, while the whistle is neutral. It does not trigger Max any response. Now let's move on to during the conditioning. When the treat is associated with the sound of the whistle, it becomes the trigger for the response, which is excitement. It is still unconditioned response because the treat is still present whenever Max heard the sound of the whistle. As the process repeated over time, even without a treat, just the sound of the whistle, Max starts to associate the sound of it with getting a treat. Now that is now the conditioned response. Now through this classical conditioning, it helps explain how we learn to associate certain stimuli with specific responses. It's a way for our brains to make connections between different events and learn from our experiences. Now, for Clark Hall, which he was an influential American psychologist that is considered one of the pioneers of modern experimental psychology, he proposed that behavior is driven by a combination of internal physiological needs and external stimuli. Now, this theory is drive reduction theory, where behavior is motivated by the need to reduce physiological imbalances or drives. He introduces the concepts of habit strength, which refers to the association between the stimuli and the response. In the diagram, the girl is in the state of relaxing, right? Or she's in homeostasis. Now, homeostasis is a self regulating process by which a living organism can maintain internal stability while adjusting to changing external conditions. It is the equilibrium, balance, or evenness of the internal environment without being overcome by the external stimuli that exist to disrupt the balance. However, as you feel something into your body, like the girl who feels hungry, it pushes her in a behavior like to find the food for a food she wanted to eat or cook a meal to satisfy her hunger and reduce the drive and the motivation to fulfill her needs. Now, in simple terms, the drive reduction theory states that when we have a physiological need such as hunger or thirst, it creates an uncomfortable state called a drive. This drive motivates us to engage in behaviors that will satisfy the need and reduce the drive. So, once the physiological need is satisfied and the drive is reduced, we experience a sense of satisfaction or relief. This reinforces the behavior that led to the reduction of the drive and increases the likelihood of repeating that behavior in the future when we're faced with a similar need. This theory helps explain how our internal physiological needs drive our behavior and motivate us to take action to fulfill those needs. It highlights the importance of maintaining a state of balance or homeostasis in our bodies by reducing drives and meeting our needs. Now, the similarity among the three theories, excluding methodological, from radical behaviorism and the operant conditioning into this drive reduction theory, all provide insights into the relationship between motivation, behavior, and reinforcement, of course, including classical conditioning. Now, in conclusion, behaviorism is that our behavior is shaped by our environment and the consequences of our actions, and understanding these factors can help us understand and predict human behavior. As I said, behaviorism is a complex area where a lot of theorists wanted to study about it. Now, there are uses of behaviorism. One is that in education. Now, theories of behaviorism is very important in education. This is a great help to teachers to understand and assess their students. By applying the theories, classes will be much more interactive. Second is that in research, studying behavior is very important, not only to used by schools, but to the society as well. And number three is in mental health. Just like in behavioral therapy, this is originally used for the treatment in autism and schizophrenia. This is to better understand the people diagnosed with mental health issue. Now, these are the relevance of the behaviorism theory. One is that understanding behavior. In the context of health sciences, this approach helps professionals understand and analyze health-related behaviors, such as lifestyle choices, adherence to treatment plans, and health-seeking behaviors. By understanding the factors that influence behavior, healthcare providers can develop effective strategies to promote positive health outcomes. Second is that behavior modification. In health professions education, this can be applied to teach and reinforce desired behaviors among healthcare professionals and patients. For example, techniques like positive reinforcement and shaping can be used to encourage healthcare providers to adopt evidence-based practices or to motivate patients to adherence to treatment plans. Third is that skill development. In health sciences education, this approach can be applied to train healthcare professionals in various clinical skills, such as surgical techniques, communication skills, and diagnostic procedures. By providing ample opportunities for practice and reinforcement, behaviorism can contribute to the mastery of these skills. Fourth is that behavioral interventions. Now, behaviorism provides framework for designing and implementing behavioral interventions aimed at improving health outcomes. Techniques like contingency management, where rewards are provided for positive health behaviors. This can be this can be used to promote smoking cessation or weight loss behaviorism. And this is also informs the development of behavior change theories, such as the trans-theoretical model, which guide interventions to facilitate behavior change in areas like substance abuse and chronic disease management. Now, overall, behaviorism offers valuable insights and practical applications in health sciences and health professions education. It helps in understanding, modifying, and promoting behaviors that contribute to improved health outcomes for individuals and communities. Now, if you wanted to learn more about the theory, you can visit these resources. Now that's all about behaviorism theory. Thank you for listening. Goodbye.